Hello everybody, Dr. Lance Robbins with iTero Family Dentistry. Welcome to Fireplace Fridays, although we're in the car. Today we're taking Bullet to go have some surgery on his knees. He's got some bad patellas and he's only 16 months old. It's going to be a long 6-week recovery. He'll still be at the office with us, hobbling around. We might get him one of those little tricycle carts he can hop around on. Just kidding. We'll let you know how it goes and keep you posted on his recovery. Can't see you, buddy. There you go.
Love you, Dad.
All right, you guys gonna pick the dog up with me? Okay. Love you. Have a great day. No kisses. No kisses for the dog. Nothing. All right. Love you.
Love you, buddy.
Love you, babe.
Oh, wait. Just keep up.
Okay. Have a great day.
All
right. Be careful.
You too. Love you.
Love you, babe.
Bye.
Bye. This is how Bullet and I travel every day, to and from work. He rides shotgun. Lets me know if anybody gets close to the car. If you haven't had the cold foam Cascara cold brew, it's really good. That's what I'm going to enjoy this morning. And Bullet's just gonna watch me drink it, because he's starving. No food after midnight or drink water. Oh yeah, here it is.
What is that for you?
Thanks, have a good day.
Thank you.
Oh. Oh yeah. That's delicious. Get you one. Well, the plan was to go through and get my coffee, get my car washed, stop and pick up an item at the shoe repair store, and then drop off Bullet. However, the line was really long at Starbucks today, so I'm going straight to the vet to drop off Bullet, and then I'll have to run my errands and finish my YouTube video today. See you soon. What a wimp. He doesn't want to leave my side. Running up between my legs, hiding behind me, under the chair. He knows something's coming. All right, buddy. We'll see you when we pick you up, okay? Love you. All right, cleaner's done. Next. All right. Gas done. Okay. I told myself I wasn't gonna do it, but I'm doing it. I'm starving. It's so bad for you, but it's oh so good. And it's so close to the office. Yum. Okay, let's get started. I finally made it back to the fireplace. Today I want to talk to you about the iTero scanner that we use here. When you come see us for the first time, we're going to take a series of records. Extraoral x-rays, meaning the sensor is outside of the mouth, which is a lot more comfortable for our patients. A 3D x-ray, so that we can look for pathology, fractures, we can do implant planning. We're going to take intraoral photos so that we can see in high definition fractures, look at the fillings and make sure we don't miss anything there. And then we're going to do a scan with our iTero machine. We do all this so that we can diagnose completely, but also so that we can monitor your oral health. With the iTero scanner, we can look at your bite, wear of the teeth, the position of the teeth, and the soft tissue surrounding those teeth. Once we have the initial scan, whenever we scan you again, we can see the changes that have progressed during that time frame. We can see if your bite has changed, wear patterns have increased, if you have more recession possibly due to your bite, and even if teeth are moving. Beyond that, the iTero scanner is used to send digital impressions to Invisalign for orthodontics. We can send it to the lab for night guards or other appliances. It can also send information to the lab for crown, bridge, and implants. However, next week I'm going to show you how we do that in-house, and so that we can provide you with crowns and bridges and implants in one day or the same day. So after our team scans you with the iTero scanner, it will process a simulation of an anticipated outcome. Now, it's not 100% because this is just simulator software. It has to go through Invisalign's ClinCheck before we get an actual expected outcome. So while this is rendering, our team will continue to take the other pictures, the other x-rays, do a consult with the doctor and the exam, and go over some of the other things with the patient. And then once this is done processing and we get the simulation, we can show the patient the before and after. So here we go. The simulated outcome is not a ClinCheck treatment plan and does not replace the ClinCheck treatment plan. Okay, great. So here's a good one. Got a little anterior open bite and possibly a little bit end to end. Can manipulate this, move it around. A little flaring of the one, and you can see where we're trying to get with this simulation. So this is a pretty good case. If we look at the uppers, you can see that more restricted arch, which is kind of causing that flaring there. But this is the simulation and where we can get that. I would probably tweak this a little bit, maybe move the canines just a little bit more. Let's look at the lower too. So little rotation there, but nice outcome here. If we go back to the front, got nice overbite, good overjet. That's a good outcome right there. I'd like to see the ClinCheck and see how long that would actually take. Not too terribly long. This is the cool stuff that we can do with the software that we have, and show you the before and simulated after. This will be very close to the ClinCheck, and lets the patient see what's possible. When you look at this current scan, looks pretty good. Here's the outcome, simulated outcome. But if you look at the individual arches, you can see how this is out of alignment, rotated in, and here's where we're simulating that we can get them. And on the lower, see some crowding, some rotations, and this becomes problematic for cleaning down the road. Get them nice and straight. It's easy to floss, easy to brush. Back to the front. We can move this around, look at it from all angles. Kind of fun. Here's a ClinCheck that the doctor goes through to verify treatment that comes from Invisalign. These red buttons here are just that. We call them buttons from Invisalign. The trays attach to them and put forces on the tooth to rotate, pull, and move teeth to where they need to go. You can look at the simulation here and how the teeth are starting. And we can look at the arch individually. Watch where we're going to move to, and I'll show you that here in just a second. Go back to the front here. Across the bottom will be the number of trays. This is 12 trays to get this patient to where they need to be, and pretty good change right there. Let's look at the upper arch, nice and straight. Look at the lower arch. We can also look at these individually from start to finish and watch them move. And let's go to the lower. From start to finish. And that's a ClinCheck. And once I like what I see there, we would approve it for treatment. And within about 90 seconds, Invisalign starts fabricating trays and sends them to us so that we can get them seated for the patient. Here are a few cases that we've done with our iTero scanner and Invisalign, and incorporating some cosmetics as well. This young patient had a lot of crowding, was having trouble getting all their teeth in place, so we went through Invisalign Teen, straightened them up here so that we could have more room for those permanent teeth that come in and put them in a much better position going forward. This patient had a tongue thrust habit, was pushing these front teeth out of alignment, and got her straightened back up. Lowers. This patient was going through job interviews and wanted to close this space, and during the 4 months they were in Invisalign, they found a job, and we took buttons off and delivered retainers the day they were moving out of town. So that was a good outcome there. It's the arch and closed space and the lowers. This young patient fell, had a little trauma, as you can see, had some chipping going on. So we pulled this tooth down so that we could recontour it. I think we still have a little bit of recontouring to do. This photo angle here is a little bit funny, but leveled these out, took the chipping off of this one, and the patient had a big smile on their face when they left. So did mom. And it's a little better angle. This case was pretty traumatic. Patient had a lot of old fillings, a lot of decay, and so we did buildups on some teeth during treatment, so that they could get through treatment, and we had a lot of spacing here, so we needed to share this space with these other teeth so that these canines and these laterals didn't look so big when we did the cosmetic work, trying to fill that gap. So we moved everything into those spaces and created a little more room for us, and you can kind of see that here. So this was the day we seated the crowns or veneers, and that's the lower. But here's the spacing we started with that day. See the buildups? Still had some buttons on there the day we started this cosmetics, and this was the end of the day. So seated crowns, and the patient was extremely happy. There's before, there's after.
Digital dentistry allows us to capture information quickly without the goopy, messy impression material that makes you gag and drool all over yourself. Come visit us at E02 Family Dentistry if you're looking for a new dental home or you're interested in Invisalign or clear aligners. And if you're a current patient, ask us about the cool technology we use to help assist us with your oral health care. We'd love to help you get that new smile that you deserve.
Okay, we're going to pick up Bullet at the vet. So we'll let you know how he's doing. He's probably gonna whimper and cry and act like a little baby. And we're gonna try not to step in any dog business while we're here.
Do we have to take him back into the right leg?
Yep.
We do?
Can you go potty? Yes.
Nice.
It's like I'm tired.
Good boy.
You wanna go potty? Okay, well, we picked up Bullet. What a sight for sore eyes. We're gonna call him Tripod. He's got his whole leg shaved and a big incision and a Band-Aid on the front right one where the IV was. And his left butt cheek looks like my head when I cut my hair.
He also looks depressed.
Good boy. But he's doing well. And there's his incision all sewed up. That's a pretty good one. And he's pretty lethargic.
Hasn't eaten, hasn't gone potty. He's just tired. Plus I gave him some drugs. We feel good. He's just resting here at home. All right, buddy. Relaxing. If you like this video, hit that like button, share it with your friends, subscribe if you haven't already, and we'll see you in the next one. Thanks for watching.